Hello students, welcome to the academia. Today I will discuss a sketch of torso showing different landmarks on the chest. Now what the things we should know, like the intercostal spaces. So the second rib joins with the sternum. So this one is the sternum, as all of you know, and this is the midline at the junction of manubrium and the body. Okay, the point can be identified by the presence of a transverse ridge on the anterior surface of the sternum. Okay, with the help of the ridge, the second rib is actually located. The space below the second rib is the second intercostal space. So this one is the second intercostal space. Okay. Subsequent spaces are then determined. So during the ECG, generally the chest leads when we put, then we should know about the exact positioning so that we can put the lead in the correct way. The following imaginary lines first of all midline. So this one is the midline. So midline, it divides the body into two lateral halves on either side. Okay. Then mid clavicular line. So the mid clavicular line, it is the imaginary vertical line passing through the midpoint of the clavicle. So this one is the clavicle. We have two clavicles or collarbones. So the mid clavicular line which bisect the clavicle. That is midway between the suprasternal notch and the tip of the acromion process of that side. Next, another is anterior axillary line. So this one is the anterior axillary line. Now the vertical line passing through the anterior axillary fold. Mid axillary line, which is the vertical line passing through the midpoint of the axilla, and the posterior axillary line, it is the area of the anterior chest wall overlying the heart. Okay. So can understand in the diagram the different lines, that is the mid clavicular, midline, anterior axillary line. Posterior is not shown here. Now some other things, like in the diagram you can see the pulmonary area, mitral area, aortic area, tricuspid area. What are these? So the mitral area, it is the left fifth intercostal space. Okay, so this is the fifth intercostal space at the left side, 1 centimeter inside the mid clavicular line. So the mid clavicular line, and it is 1 centimeter inside. Now tricuspid area, it is on the left side of the lower end of the sternum. So this is the tricuspid which is present in the lower end of the sternum. Then the aortic area, it is in the right second intercostal space near the sternal border. So the second intercostal space near the sternal border. And the pulmonary area, it is the left, it is also present in the left. So this one, left second intercostal space near the sternal border. Okay, so can identify the first intercostal space, second intercostal space, third intercostal space, fourth and fifth intercostal spaces. So these landmarks and areas are used to denote various points on the chest. Okay, and it also helpful for the placing of the chest leads during the electrocardiogram.